what's really interesting is the employer is only now discovering, I think, a new power, a new might. We've always called the insurance carriers the payers, but they're not really the payers. They're the administrators of payments. And that's a very different role for the insurance companies who saw themselves as the arbiters of what should be paid and how much. What we're now seeing is employers getting very involved with what should a payment be and negotiating in some cases directly with the physician. And this is new and different, and it's also changing that power relationship. I'll give you an interesting example. In the Northeast, there was a grocery player. And the grocery player said anyone can have a hip or knee replacement in Singapore if they wish. The cost will be to the company about 40% cheaper. So the employee was offered for themselves, a spouse or friend, and a $5,000 bonus. And while it didn't have immediate impact, what it did send was a big signal to the healthcare systems in the Northeast that unless you bring down the price of some of these procedures, you're going to be forced to consider global competition. Another employer is actually starting to think about, look, we can be self-insured now. Self-insurance used to be for, the Fortune 50 companies. Now we see employers, say only 1,000 people, saying, it's realistic to self-insure, to give incentives to employees. They're certainly allowed and are now starting to push wellness programs, discounts if you stay well. So we're seeing a new power emerge from these employers. And I think once they really take this power, it's going to be very hard to wrest away from them. The people that pay the bill are fundamentally changing. And the moment you pay the bill, the employer, the consumer, you start to gain power, and you couple that with the transparency of data, and you're really starting to see the fundamental fabric of the healthcare system and the power relationships change.